Thanks to everyone for joining us. This is another distinguished speaker by the Institute for Addiction Science. And today we have Morgan Philbin, who's an assistant professor at the Mailman School of Public Health at Columbia University. She's also a visiting scholar at UC Berkeley. Her work examines how social policies and clinical practices shape inclusion and health equity for marginalized populations, including racial, ethnic, and sexual minority individuals. This includes mixed method research that explores how individual social policies and policy climates as a whole affect health disparities for minoritized populations with a focus on HIV, substance use, and immigration. She's PI of the NIDA-funded K01 and NIMH-funded R34, and is co-investigator on multiple federal and international grants that she's conducted related to substance use in the United States, Mexico, and China. Just on a personal note, I think I met you 4 years ago. Very impressive, and following my first principle of find talented people and make friends with them. This is my effort to continue to cultivate that relationship. So Dr. Philbin.
I thought it was really going to do it. Thanks, Ricky. Yeah, we met at a baseball game at a conference. So when people tell you go to all the sessions, I mean, yeah, right? There are a lot of reasons to go to conferences. So first, thank you all so much for inviting me to come talk about this. I'm really excited to share. And also, as I'm sure unsurprising, this is the first talk I've given in person in like 3 years. So it's also kind of bizarre. Yeah, so here goes. So briefly, as Ricky mentioned, there are a number of lines of work that I have. Today, I'm presenting on my work on cannabis policies. And I'm particularly interested in social policies more broadly. So I've been looking, I have a grant focused on opioid policies that was recently funded and the impact on pregnant people. And then immigration policies has sort of always been, I don't want to call it a side hustle, but it's unfunded. So maybe it is a side hustle, but it's just sort of where my heart is. And so that's one of the projects that I've been working on off and on actually since my dissertation. And then I also have a line of work focused on HIV, and I'm particularly interested in how biomedical technologies are scaled up in ways that can exacerbate health disparities. So thinking about things like PrEP, long-acting injectable formulations, and what does that mean about who even gets offered, who can get to services, and basically are we making things worse as we scale this up by, as we saw with PrEP, pretty much only really getting it to affluent white gay men. So those sorts of questions are really what's been driving my work. And then one of the things too, briefly, while I am talking about individual policies today, I'm really interested in the policy climate as a whole. So thinking about, obviously, the world that we live in, there's so many different things shaping it. And so really trying to think about how do we move beyond, for example, conceptualizing intersectionality at an individual level to thinking about it structurally. So I've been working on a project with some colleagues in sociology, working to create a policy measure of structural heteropatriarchy. So integrating policies that regulate sexism, LGBT health, and reproductive health. So that's some of the work that we've been doing sort of broadly. So if any of that is at all related to what you all do, please let me know. Great. So for the paper or the projects I'm going to be talking about today, I just want to start by focusing on cannabis policies in the US. This map will be familiar to some of you, but I just want to highlight sort of where we are to make sure we're on the same page. So for this map, states that are either dark green or light green have legalized cannabis for medical use. Those that are dark green have also legalized cannabis for recreational use. Unsurprisingly, you can see some geographic disparities of which states have legalized what. Initially, it was the more liberal states politically that had legalized recreational use, although that shifted over time with states like Montana, for example. And although 19 states, so not even half, have legalized cannabis for recreational use, given that they're in population centers, nearly 50% of Americans live in states that have legalized cannabis. And so this really brought me into this question of, okay, we're legalizing this, and we need to think about broadly what is happening beyond simply impacts on cannabis outcomes. And obviously that's important. I'm going to talk about that, but I'm really interested in thinking about what are the other things that may be shifting as a result. All right, so why, right? Why cannabis policy? Why does this matter? Obviously, as I just mentioned, we've been passing policies quite quickly. This started in '96. California was the first state to legalize medical cannabis. And then in 2012, Colorado and Washington started legalizing cannabis for recreational use. And research has shown that adult cannabis use increases in states that have passed medical cannabis laws, and likely recreational policies as well, but the impact on people under 21 has been mixed. And in addition to still not being sure how this might affect young people, little research has really started to disaggregate groups, or we've sort of done the population as a whole. But what does this mean by gender, by race, ethnicity, by sexual identity, things like that? And so that's been one of the things that I've been focusing primarily on, and is what I'm going to talk about today. So I'm going to start with some of the work I've done on sexual identity and then focus on Black and Latinx young people. And that will be the qualitative work, which will be the majority of what I'll talk about today. And I also wanted to bring this up because there have been so many debates around the legalization of recreational cannabis and why we should or shouldn't do it. I mean, obviously there is big business like anything in it, but also advocates have really used a social justice-based arguments to call for the passage of recreational cannabis and really frequently point to the disproportionate impact of cannabis criminalization on specific communities, specifically communities of color. However, as I really want to hammer home today, there's so much more that needs to be done beyond simply legalizing cannabis, right? That is, we talk about epi, right? Necessary, but not sufficient. And so this idea that we can simply say, once we legalize it, this will be solved is just not true, right? Police still enforce laws. We've actually seen in states like Colorado and Washington, which have been, it's been about a decade since they legalized, that overall arrests have gone down, but the racial disparities in arrests have actually gotten wider. So really wanting to kind of push forward and think about that we oftentimes push so hard just to get a policy passed, but really the importance of making sure it plays out on the ground in a way that is not actively detrimental. All right, so I'm going to start today by presenting some of the work I've done on medical cannabis laws and disparities and differences by sexual identity. And so, as many of you know, research has shown that disparities in substance use by sexual identity are primarily due to a result of the way that individuals respond to stigma and discrimination that they experience. And these experiences of minority stress tend to be particularly acute for bisexual women, oftentimes because they face factors such as victimization, internalized homophobia, concealment of identity, and rejection from both heterosexual and minority communities. So given that, I'm going to focus the next segment on bisexual women since there were the largest disparities. And I really want to note that the use of cannabis and substance use more generally among these populations, among sexually minority individuals, is a completely rational response to dealing with the societal stigma that they're facing, right? So I'm not saying this in a way that I want it to be pathologized or moralized. I'm really saying that this is why, you know, if you are living, we actually sometimes joke that when we do this work, we're really proxying out like, how terrible is your state with an epithet instead. And like, trying to think about what are we doing when we create these policies that make it really hard for somebody to live as they are, and then we turn around and critique them or pathologize them for having high rates of substance use. So I know this is a soapbox, I'm going to get off it, but I just wanted to sort of set that frame of we will see disparities. They are a reason they are there, and it is a very rational reason. All right, so statistically, we use the National Survey on Drug Use and Health. For those of you who've worked with it, it's far from perfect. It is what we have. It is a national and state representative annual survey, which is why so many of us use it. It's really hard to get state-weighted data across all 50 states, across time points. It's repeated cross-sectional, so you can't follow the same people over time, but at least we can look at trends. It is community-based, which is really important. It's a household survey, 12 and up. Unfortunately, they don't ask people under 18 about sexual identity, which is frustrating for the work that I do. Again, that was politics at play. It took them until 2015 to even ask at all. So we'll take what we can get. But just to flag that. So the pooled sample that we have for what I'll present now is about 125,000 people. It only goes up to 2017. And that is because when we did the analyses, we only had access to data up until these years. And because of COVID, the place where we would go, it's called the RDC, or the remote data center, the research data center, excuse me, was closed. So we are now going back, I'll talk about it next steps, and doing this with additional years, but we just were not able to access additional data at the time when we did these, but we still wanted to do the analyses. All right, so these, the analyses that I'm presenting right now are pretty basic, but there was no data out there, so we needed to start somewhere. So this is what we did. But like I said, right now, we actually have much more detailed analyses that we're waiting to get clear. So that's the problem with these remote data centers. You have to get there. It's like the closest one is about an hour from Columbia, and then it can take months to even get it approved. You have to set in all your table shells ahead of time. For those of you that do analyses, we all know everything's iterative. So that's like literally you have to set everything you could possibly imagine. You can only send in 1 or 2 proposals a year. It now costs money. So it has been a nightmare to work with. to the point where we've actually changed grants to avoid working with it, but it is also the best we have. So there's a lot of challenges.
Can I ask a quick question? So what do you get from the restricted use data that you can't get from the public?
Yeah, so we know which state someone's living in versus whether they live in a state with a medical cannabis law.
Okay.
And so by knowing which state they're in, we can actually control for state level variables that we wouldn't be able to otherwise. There's also some county level data that is harder to get access to, but it is there. So that is the benefit. You also know more about the individuals, you know how old they are versus the broad age category that they're in. So it's basically, yeah, to your point, which is sort of that trade-off of like, either you can do it from home and actually like get out the paper, or you can take 2 years to do it. And they're literally like, I had to get special sworn status from the FBI to go in there, even though the data is de-identified, but it happens to be housed in the same area as the census data. So like trying to explain to an FBI agent, he's like, wait, you have multiple projects? Like, what's your job? And I was like, no, by definition, like, it was just like, that was a whole nightmare. But yeah, so it's like, it is just really hard to get students involved. And so yeah, thanks you for bringing that up. So the exposure that we used for this paper was sexual identity. So the choices were heterosexual, gay, lesbian, or bisexual. And then the moderator was whether or not they lived in a state with a medical cannabis law. So to your point, we knew whether they lived in a state, but we didn't know which state. And so the study aim overall for this paper was to explore whether cannabis use outcomes differed by sexual identity based on whether somebody lived in a state with a medical cannabis law. And then the outcomes, there were 4 different outcomes. One was any past year cannabis use. One was daily use, which we define as 300 days a year. One was the DSM-4 cannabis use disorder. It's a proxy. We're now trying to proxy out 5. We don't have cravings. It's not perfect, but again, it's as close as we can get. And then past year medical use. All right, so what do we do with that? So we did a weighted multivariable logistic regression to examine the association between sexual identity and cannabis use outcomes. For now that we're in the RDC, we can do multi-level models because we know what they're, we know how to nest them. We didn't for this. So the first part was just to see basically, is there a difference by sexual identity, which we thought there would be given previous research. And then the second was we again used weighted multivariable logistic regression to see if there were actually differences in outcome based on whether somebody lived in a state with a medical cannabis law. And we also stratified by gender, given the differences we had seen, particularly among bisexual women. And then we also used interaction terms to see if there really was an additional difference between sexual identity and medical cannabis law status. So I want to start just briefly. I'm not going to go into too much depth here, but really the point of what I want to show you here is there are really stark disparities. So if you just start on the left-hand side for past year use, if you look at yellow women, since I'm focusing on bisexual women primarily, it is past year use is 10% for heterosexual women and 40% for bisexual women, right? Past year use, and I mean, from a public health perspective, if somebody smoked weed once in the last year, do we care that much? Not really, no. But for, sorry, my politics are real clear on this one, but no surprise, harm reduction is where it's at. So, but for when you get into daily use, we start to see really stark differences, and that's where there can actually start to have an effect on people's lives more generally. So these are the sort of differences that start to be more potentially problematic, not always, but maybe from a public health perspective. But when you start seeing past use disorder, we're also seeing, right, a sort of eightfold difference. So these are where these questions start to show up of, okay, why are we seeing this, right? We also see differences in medical use, which I'll talk about a little bit and why we think that might be. One of the things too, which is always interesting, right? We do these analyses, we publish them, we present them at conferences. You never know where they're going to go, right? You sometimes hope someone's going to read them, who knows? So actually, when this paper came out, I got this email that I at first thought was spam, but it was for Dan Savage's Savage Love podcast. And so that's like, he didn't care at all about the stats, and he was like, how do bisexual women smoke so much weed? And I was like, and it was just like this funny moment of me being like, the tiny bit of media training that I had in front of like the faculty did not, but it was just like a totally different way of doing it. And I just kind of had to figure it out on the fly. But you never know who's going to listen or watch or see what you do. All right, so what I'm going to talk through with this, don't worry about looking all the numbers, is given the previous work, we would expect to see differences in medical cannabis law by state status. And we did, right? So as you see, as we had seen before, people who identify as heterosexual, their use went up for all 4 of the outcomes in states that had passed medical cannabis law. Or there was a difference, I should say, not that it went up because of the way we have the data. that there was a difference. However, one of the reasons we did this is because we wanted to disaggregate bisexual identity. And so, and I'm focusing on bisexual women for the sake of this, but I'm happy to talk more broadly. When you do this, we don't see the same differences. And as you eyeball it, you can see like, sorry, I'm sort of torn between talking to you and talking to the camera. Like if you eyeball it for like, lesbian and gay folks, we don't see that same, we don't see it uniformly either. So some of it you could argue maybe a power issue, but it really actually suggests the importance of disaggregating these data to really look at why are we seeing these trends. And so one of the things that we think for bisexual women in particular, if you think about the initial disparities, that baseline rates were so high that introducing additional access to medical cannabis really didn't do that much for them if they were using it recreationally. However, we do see a difference for medical cannabis. And so, which in a way is great because it's suggesting the law is operating as intended, right? That it is, people can actually access more now that it is available medically. So that is good. We didn't see the same for bisexual men. We think that is potential. We don't know if it's a power issue or not. The numbers got to be quite small by the end. So just briefly as a discussion before I move on, we did see higher use among bisexual women overall, as you saw, particularly for daily use and disordered use. And while beyond the scope of these analyses, because the NISDO doesn't include these type of questions, unfortunately, around stigma or discrimination, we think it probably has to do with those sorts of experiences. And that might mean that people are using cannabis to self-medicate, even in states where it's not legal. And so we are actually seeing that. The other thing that we saw was that there were differences in the associations between the relationship between medical cannabis law status and cannabis use, that association differed by sexual identity. And so again, this could be because of higher baseline rates. And so there wasn't that shift, and maybe for other reasons, which is why I'm going to put in a plug for qualitative work and just actually asking people why their behaviors are what they are. Because obviously quantitative data is incredibly important, especially on a national level, and there are limitations because you're beholden to what the questions are. So for example, the NISDO, for all that it does, didn't decide until 2020 they should ask about vaping. Kind of a problem when you're doing cannabis research, right? So there are things like that are a challenge. So in terms of next steps, so now again, we finally have access to the RDC, so we get that state-specific data. And so that also allows us to look at the impact of both medical and recreational cannabis laws. So that's really exciting. We have some initial output. We redid it. We're waiting again for the approval. So that's the other thing. It can take a couple months for someone to sign off on your Excel tables that they already approved in the beginning when you applied, but it's a challenge. And so it just takes time in a way that's quite frustrating. The other thing is we're really interested at granular data differences on the county level, because it's one thing to say, great, like California legalized cannabis, but their counties that don't have any dispensaries. So what does that even mean, right? If you have to drive an hour to a dispensary, obviously we can get weed, from our neighbors or whatever. But if you're thinking about additional ways that the switch to legality has affected things, or you can look at home cultivation limits. And so that's actually the other thing that we're thinking about granularity, not just in terms of geographic region, but also in the way that the policy exposure itself is measured. So right now, most work is done, is it legal recreationally? Is it legal medically? But really thinking about, like I said, home cultivation limits, taxation, dispensaries to really actually get it access versus just what's on the books. All right, so now I want to shift to focusing on Black and Latinx youth and young adults. And I'm going to start by talking about a bit of the quant stuff, but then really spend the rest of the talk focusing on qual. So I just briefly want to set the stage here. As many of you know, there are actually few differences in prevalence of cannabis use rates by race ethnicity. There's actually almost none. I'll show that in the next slide. However, unsurprisingly, given the state of the country, there are incredible differences in rates of enforcement. And so that is something that has been really challenging. So just to give you some numbers from New York, if you look at Black and Latino males, young people, so 14 to 24, they constitute only 5% of the population, but make up 40% of reported stops. And similarly for possession, so it's not just, conviction. So it's not just are they stopped, but are they convicted? There's about 2-to-1 disparity. So about 15% of cases among white people end in conviction and 33% among Black individuals. So we're seeing these differences in arrest rates by race ethnicity. We also see them by sexual identity and orientation. That's a little bit harder to measure because you have to have very specific data sets. I mean, we've seen anecdotally just working with young people and also who ends up in the criminal justice system. But so it is both race, ethnicity, and sexual identity, particularly gender identity, because that's often easier to read in a way by class. And obviously these disparities are always detrimental. They're particularly detrimental for young people, because having a criminal record has such a significant impact on young people's ability to do things like get an education, get a business loan, find housing, general opportunities for growth and development. And then lastly, while I'll turn to this in more detail in the qualitative research portion, I just really want to highlight that policies are not just important because of what they make legal. So for example, saying, yes, medical cannabis is legal or recreational cannabis is legal, but the symbolic power that they hold. And so policies are not just the passage, but the way they're deployed and enforced holds incredible power in who becomes the target of these policies when they are enforced. And we tend to think about this in relation to policies that target a specific sort of identity aspect of an individual. So thinking about immigration policies or marriage equality policies. However, a lot of policies that shouldn't ideally, right, on the books, so around substance use policies, target a specific individual, we actually, because of how they're implemented, see that play out. And this also then translates to young people about who belongs or who is worthy of belonging. So I just sort of want to flag this. I know it's a little bit more kind of social theory. For those of you who that's more what you're doing, thinking about like Foucault's notion of biopolitics and biopower, the panopticon, sort of how people then come to internalize when they are constantly under surveillance and start to even engage in self-surveillance. So this is kind of what I was playing around with in my head when I started doing some of these interviews. I know that's a little outside the realm of public health, but that's kind of where my brain works for policies. So I'm going to start by presenting some quant analyses that our team has done to set the scene, and then that'll serve as a framing for the qual. And I'm happy to go into more detail on these in the discussion, since the quant piece is going to be a pretty brief overview. So we examined whether there were differences in cannabis outcomes by race and ethnicity after the legalization of recreational cannabis. And so to do these, we actually had access. We were able to do this right before COVID hit. So we had access within these data centers. And so we used the same annual survey. We had data from 2008 to 2017. And so we looked at similar outcomes, as I mentioned before, past year use, daily use, disordered use. And we're now going back and looking with more recent data now that we again have access to the remote data center. And then analytically, we use multi-level, again, so we could get the multi-level piece in there because we knew what state people were in. So multi-level logistic regression with state level random intercepts. And then we could control for both individual and state level covariates with this one because we knew what state they were in. And then we did 2- and 3-way interactions looking between the recreational cannabis law status, race, ethnicity, and age group. All right, so I know there's a lot going on here, but basically what I want to convey with this heat map is from the bottom, the x-axis is time, so from 2008 to 2017, and it is showing the different categories. There are 6 categories of states that can exist. So these are states that have never had medical cannabis or recreational, states that didn't at the time have medical cannabis, but will not have recreational, states that had medical cannabis, but not yet recreational. So you can just start to see over time, ending at the bottom in the yellow, with states that actually had already passed both medical and recreational. But basically what I want to show you with this is that there's actually quite a fair level of variation. And obviously this is through 2017, when there were only, I think, 9 states that had passed, we're out to 19. So there's even more now, but also that it's moving really quickly, which is good in many ways, and also means that things are moving and we're still necessarily trying to figure out how to make sure the enforcement is done in a way that is not actively making things worse. So in terms of some of the basic statistics, what I want to show you here, what I want to start with is going back to my initial comment of there being very few differences in use by race ethnicity. So this is past year use. So go ahead and ignore the differences in the green and yellow bars. That's before recreational and after. What I really want you to focus on is if you look all the way in the left, so if you look at these, say, age 12 to 20, age 12 to 20, age 12 to 20, right? You look at these differences, so it's 25% for non-Hispanic white, 15% for Hispanic young people, 20% and 22% for non-Hispanic Black, right? So the differences are minimal. I'm also using the term Hispanic because that's what's in the NISDU. I tend to use Latinx or Latin when I do it myself, but just to keep consistent with what they use, that's why I'm doing that. So basically, there is no difference in use. Fine. What is interesting is we're also not seeing changes across the most categories before or after cannabis was made legal recreationally. We do see a difference in Hispanic individuals ages 21 to 30, although again, baseline rates were quite low. So they're still, even with the increase, they're still lower than we see among non-Hispanic whites. And then we did see a slight increase there, but we didn't see any changes for young people 12 to 20. Again, legalization is for 21 and over, but as we know, we've seen this with alcohol policies, right? Like, I mean, any of us, right? When we were in high school, we could have probably give us 10 minutes, right? We would have found weed. It's not that hard to get, even if it's not legal for however old you are. But we aren't seeing a difference, which is interesting in many ways. We can talk about why we think that is, but it's also important when we talk about policy change to be able to say, we are not seeing a shift, and we're not even seeing much of a shift for people 21 to 30, suggesting that we're not, in changing policies, we're not going to create this huge group of individuals that all of a sudden is starting to smoke that wouldn't have before. We then looked at past year cannabis use disorder. And we did this among people who report use. And the reason we did this is because we were interested in among people who are using, is there disorder use? And we can, some people look at it just overall, but then the denominator can shift depending on, are more people using or not? And we were really interested among people who are using. So there are two main takeaways from this that I want to share. One, we didn't see any change pre and post. However, and this is something that really surprised us when we're trying to figure out, cannabis use disorder was really high. And so I am not a psychologist. We started talking to people about, is there something different about the way the DSM criteria shows up? Yeah, I see some nods, right? For people who are 12 to 20. And so that may be part of it. So I just want to say this is something we've noticed. We don't have answers yet. But in general, we did not see a shift. One thing I do want to notice too, is that it might simply be because these policies haven't been in place that long. It might also be that the states that originally passed cannabis laws had different attitudes towards cannabis, right? So there's a huge difference, obviously, between somebody who smokes a joint in the evening in the same way somebody would smoke a glass of wine after dinner, than somebody who has cannabis use disorder. I think also the way it's talked about, I think the narratives around stigma and if you need to seek help, can you seek help, may be very different in states like California than Montana, right? So these are hypotheses. These aren't, things we were able to test in the NISDU, but there may be some of that going on. So we'll need to keep looking at this to see if these patterns change over time as more states have introduced these laws and we have more person years to play with. All right, so in sum, we found no overall differences by race, ethnicity, and prevalence of use. And there were significant changes in past year cannabis use for young adults ages 21 to 30 who self-identified as Hispanic and non-Hispanic white. We didn't find any associations between recreational cannabis laws and outcomes among youth 12 to 20, nor for cannabis use disorder at all. But again, like I said, some of these enactments are more recent. And we've seen too that even a lot of states that passed recreational cannabis laws, it takes a while for industry to sort of catch up to match sort of what we're seeing. So by that, I mean, a lot of dispensaries are coming online now in ways that they weren't when it was initially passed. So as people have more ready access, and also in terms of the race ethnicity piece, as we have seen with tobacco dispensaries, the advertising tends to be targeted in very specific neighborhoods that tend to be, and it tends to be more common among neighborhoods that have higher percentages of people of color. And so that is also something to think about of the way that the industries continually sort of take advantage of this. So these are all things, again, it's like when stuff is moving really fast, it is important to think about. And also there's still a lot of things that we're figuring out. And I'm very honest about what we know and what we don't know and why this work needs to continue to be done. All right, so qualitative, this is sort of, for those of you who know me, it's where my heart is. Obviously national level data is incredibly important. It's the way we need to understand trends. We need to establish if there are associations, but it really doesn't tell us what's happening on the ground and also the experiences of individuals outside of cannabis use outcomes. Right? Or we can look at, mental health, but thinking more broadly about, what does it mean sort of day to day for you to now be in a place where, for example, cannabis has become decriminalized or it's become legalized, and what does that mean? So given that, we conducted qualitative interviews with young people in New York and with community stakeholders across the US to really explore how these shifting policies impact the health and well-being of Black and Latinx youth and young adults. So since the young people we interviewed were in New York, I just want to give you a brief history of cannabis policy there to set the scene. So New York actually first passed decriminalization policies in 1977. but they were never really enforced. It didn't do anything. So then in 2014, when New York legalized medical cannabis, the then mayor, Bill de Blasio, actually started enforcing more of the decrim policy. And so, for example, prevented police from making arrests for public view possession. And then in 2018, the New York State Police Department began issuing tickets for public smoking instead of making arrests. And then in August of 2019, they expunged about 20,000 minor cannabis convictions. And then it was legalized in 2021. So again, main takeaway, although decrim's been on the books since the mid-70s, it really didn't actually start being enforced until 2018, 2019, which is we started these interviews in 2019 and then went into 2020. All right, so I just want to touch a bit more on the theoretical framing of policies before I dive into this. So as I mentioned, policies can shape notions of belonging and inclusion and really convey who is allowed to occupy certain spaces or sort of who is worthy of inclusion in broader society more generally. So obviously we talked about marriage equality, immigration, we can think about redlining, for example, access to certain neighborhoods. There's a lot of sociology literature on the militarization of urban space. So if you think about even college campuses, they all have these giant gates that are never actually locked, right? But it's very clear, like certain people are allowed, certain aren't, even the like libraries and the way that they're built now, with like the benches with the dividers, like there's a lot of these interesting ways that I don't think we think about necessarily until we actually look around and like, oh, why is the sort of urban built environment created in this way? But again, right, we have these policies and processes to really sort of show who is allowed to be somewhere. And so in this framework, notions of illegality aren't an inherent quality, but these, it's something that is a product of these social processes or these policies, right? And not just what is passed, but how they're employed. And that's really what I'm focused on for the cannabis policy piece, because it sort of creates this notion of whose identities are valued and judged in a specific way. And then, as many of you know, and I'm going to talk just briefly of a quote from Goffman, it is not just that these are conveyed in a certain way, but they then become internalized, right, and self-replicated within because people internalize the way that they're seen. And I think that this quote from Goffman really does a good job of talking about how these internalization of negative stereotypes can have a powerful impact on individuals, particularly young people. And I think for young people especially, it can affect how they engage in social services and envision and pursue future trajectories. So the quote is, "The standards incorporated from the rest of society equip him to be alive to what others see as his failing, inevitably causing him to agree that he does fall short of what he really ought to be." And that is sort of what got me thinking about, okay, what does it mean about the ways that law enforcement enforces, right, these policies on the ground and who they choose to enforce them with. Even though, again, this is not like marriage equality where it's a specific population, I thought because of these disparities, I really wanted to think more about this. All right, so methodologically, we did 68 interviews. It was 30 with young people in New York City that were 18 to 29, self-identified as Black and Latinx, and this was 2019 to 2020. And we recruited them through outreach events and communities, bars, clubs, and snowball sampling. And they received $50 in a round-trip Metro card. Excuse me, and we really focused on their experiences and knowledge related to cannabis policies, suggestions about how to improve such policies, how it affected their daily lives and experience with their friends. And then we also interviewed 38 community stakeholders. And one of the reasons we did this is we wanted to interview people across states whose policy climates varied to really get a sense of states that didn't even have decrim on the books for decrim, medical, recreational, so there was quite a range. And these included state and local policymakers, individuals at NGOs, professionals in health, education, social services. And we recruited these individuals by email and telephone and snowball sampling as well. So the interviews were 60 to 90 minutes. They were transcribed verbatim and we used Deduce. I'm happy to talk about I've used Deduce, Atlas TI, a number of them. They all have things that are a little bit frustrating, but overall we found Deduce has been the easiest for working across teams in different places. And then there were 3 of us that read and coded the transcripts using a line-by-line approach. And then we created a list of thematic codes based on existing literature, as well as what came up in the interviews to create a code dictionary. And then we refined this, and then 2 master's level students finished coding all of the transcripts. And I do want to note these interviews occurred in New York City after cannabis had been decriminalized and while discussions of legalization were ongoing, but it was actually, we finished like 2 months before it was actually legalized. But young people were very well aware that that was coming. So what I briefly wanted to highlight with the demographics is a couple of things. One, as much as we really wanted younger people, we had a hard time in that sort of 18, 19, 20, which has sort of always been a challenge. And even when I tried to do it lower, 15, 16, 17, But because the age of legal use for cannabis is 21, we still, at least we have people who technically would not have fallen into that category. You can see there was a mix of race, ethnicity, and mix. One of the things we also really tried to do, and this is a whole other thing I'm happy to talk about, is the way that similar pools of individuals tend to be recruited over and over again for the same studies. And so really thinking about trying to get as broad a range as possible. So we really pushed to get people, so you can see that, the monthly income was $400 to $7,000, right? So it was quite a range of people. And so that was something we looked for, and we really wanted a range of education, and we were able to get that, which was wonderful. The majority were employed, and then almost everybody had insurance, primarily public insurance. So there were 3 main themes that came up. I'm going to go through each of them and give some example quotes. So one was around the differential policy enforcement and regulation of space and sort of how you felt moving through space. The other was how young people use cannabis to manage stress, and the role of service engagement, what that meant for how they engage with other services, and then how cannabis legalization could be a tool to counter the discrimination that they faced. So one of the first things that came up is participants were very, very clear about how police weaponized cannabis enforcement to justify the surveillance of specific neighborhoods, particularly Black and Latinx young people. And this surveillance was something that they had talked about coming out of Bloomberg's history of stop and frisk. Like, there was quite a legacy in New York City around, everywhere, but New York City especially around this. And they were very clear of like, no, this is always a pretext. We know this is happening. It happens in specific neighborhoods more than others. And they felt it was particularly common when they were, in neighborhoods that police would sort of say, oh, you were out of place here. And so this was something that they felt like there were very specific racialized boundaries in the city. And so they said, especially this happened in neighborhoods. They kept talking about Chelsea and Greenwich Village as examples. And in the work I do with LGBTQ+ youth, we heard this all the time, the sort of intersection of sexual identity and race ethnicity, of just how like white Chelsea is in the space for sexual and gender minority young people. And so one participant talked to me about how he was sitting on a stoop in Greenwich Village, waiting at his friend's apartment, waiting for his friend to come out. And he said police came up, and he could tell they were basically trying to figure out what he was doing there. And when he was like, look, I'm waiting for my friend. And they're like, okay, sure, wait, right? And he's like, and then, and you can see, he said, first they tried to tell me I was trespassing because I was sitting somewhere that didn't look like I should have been sitting. And then they start searching me, and they conjure up this little piece of marijuana. So it was this idea of, right, it was a very clear sort of interception of space. And then the police saying, oh, this is a pretext now that we are allowed to do this search, even though it was decriminalized at the time. And so the differential enforcement tactics really affected how young people access public space and caused them to feel othered in specific neighborhoods. And this really could translate or sort of transition spaces that young people should feel comfortable moving in into these spaces that they were made to feel out of place or like they were trespassing. And so these tactics continued across multiple of the narratives that I heard, specifically how police would code Black and brown bodies as out of place and therefore a target of interception when they, when they would be specifically in certain neighborhoods. So for many participants, this symbolism of exclusion really impacted them psychologically through chronic stress and fear and this constant level of surveillance. And one participant in particular described the effect of this profiling when he was hanging out with some friends in the West Village near NYU. And I use the term bleaker cops. Bleaker's a street nearby. So he said it was about 30 of us in the park, and then all these bleaker cops, like 12 to 20 cars, rolled up on us, guns blazing, everything, and just threw us all in their cars. I really felt Black. And aside from the fact that, like, when you do these interviews, and it's just like, how do you? Yeah, it was one of those moments where it's like I just didn't know how to respond, and I was like, of course, and there was just like such a clear dissonance between how he saw himself and how he was perceived through the eyes of police just for literally hanging out in Washington Square Park, right? And so it's these types of moments that really show the symbolic power that these policies have in the way that they are, employed on the ground, and how they can affect people's understandings of themselves, right? And what it means for them to be in certain spaces, in public spaces. And another participant talked about the stigmatizing effects of these policies and talked about them as creating a, quote, stamp of disapproval. And also this person noted that they serve, quote, as a reminder that you're not accepted. And so in these narratives, we really see this link between place and personhood, and how this enactment was effectively white supremacy, right? Limits these young people's rights to inhabit and move through space, and also attacks their sense of identity and belonging. So moving to the second theme around using cannabis as a way to manage stress, a lot of participants talked about how they use it for anxiety, anger, and depression. And so they felt that decriminalization and ideally legalization can actually help reduce some of that burden of allostatic stress and the internalization of racial discrimination that they experience on a daily basis. And so they really talked about how decrim policies made them feel like they were in control of the ways that they could manage their mental and physical health. So as a 24-year-old mentioned, you know, marijuana helps with so many things. So most of the time I smoke, it's usually if I pulled a muscle or whatever, I'll try to massage it and then smoke so the pain can go away. Or sometimes there'll be times when I'll get depressed and not eat. So when I want to eat, even though I'm depressed, I'll smoke. And so they talked about how it was actually really important for them in the way that they manage their day-to-day lives. But also they talked about this cycle, this challenge of, okay, so I get stressed and so I'll smoke. And then I know there's a higher likelihood that I have an engagement with law enforcement, or I do, and then that causes me to want to smoke, right? So there's the cycle that we're seeing because of the way these policies are enforced. And so it was a reason that a lot of them really were pushing for legalization. Obviously, we've shown legalization is not a panacea, but it is a start. And the other thing too is that participants talked about how they felt a better sense of security and how they navigated neighborhoods and engage with peers because of decrim. So those that could say, look, I know my rights. I know I may still have an encounter with police, but at least I know now that I cannot be arrested. So as one of them said, one of the young people said, you know, decriminalization was the only reason I was going outside to get weed, because I knew that if I did get stopped by police, they would just confiscate it and give me a ticket. It makes you feel more comfortable and you don't want to feel scared, because when you feel scared, you look scared, and looking scared and being brown is not a good idea when you've got weed on you. Right. So they were very, very clear about the intersection of race and cannabis and the policy enforcement. And I bring this up, I know I'm sort of like repeating this, but I'm saying this because these are not the things we're seeing as much in the discussions around the policy implementation. We see it in sociology, we see it in criminal justice, right? It's not that these narratives aren't there, but it's the intersecting of the fields is something that I think is really important and that is getting missed. Sort of flagging that. And then the last piece of the theme that I wanted to flag is that previous work has suggested that the negative experience with one social institution, so for example, law enforcement, can cause youth to avoid or distrust social services from other institutions, right? So education, housing and homeless shelters, things like that. And so that's particularly important, because if people are having these negative experiences with law enforcement, which then would, you know, suggest or show a definite need for mental health services, for example, but then they don't trust those services, it becomes this really vicious cycle. And so, and also just access to, or smoking weed in general, I should say smoking, using cannabis in general, can also affect their access to services. So as one stakeholder in Nebraska told us, because I would say briefly, in Nebraska, a lot of the shelters would test if somebody was using cannabis before they would allow them in. So she said, if cannabis were legal, then some of those youth could actually go to other shelters if ours were at capacity. There's been so many instances when our shelters are full and we have a young person that needs a place to stay, but because they smoked weed a couple of days ago, they aren't eligible for other shelters. And that's obviously very frustrating. If marijuana were legal, this wouldn't have been an issue. Right. So then they're coming up against these moments of like, oh, this service isn't available, or this isn't, or then I don't trust it. And so despite a need for social and medical support, these young people really talked about having less access than they would want to specific services. All right, so the last theme that I wanted to talk about before I wrap up is thinking about how the legalization can be used as a tool to counter this discrimination. So while participants identified perceived benefits to, you know, to decrim or to legalization, many really were clear that decriminalization was an insufficient tool towards meaningful social change. And that's specifically because it failed to address these disparities in enforcement and arrests. So as one 21-year-old said, look, I can have $5 worth of weed on me and I'll still get arrested with no warrants. Weren't you supposed to just give me a ticket right then and there? Why did I have to be put in handcuffs, sent to the precinct, to put my fingerprints onto that thing to figure out who I am, and just to see that I have no warrants? Really? For a $5 bag? So it's interesting, right? We're seeing some people that are saying, I now feel better walking through my neighborhood, and others that are saying, it doesn't matter that it's decriminalized, right? This is still happening. And there still is this power play going on. So really saying this is why we need to legalize it. And then another thing too was talking about the implications, right? So one of them noted, a 27-year-old, that, you know, it's a big impact for an arrest, right? For this 25 grams of weed, because a lot of young adults smoke weed. And then instead of being locked up and ruining your criminal record and not getting accepted into college and stuff like that, you just get a ticket. That would be a plus. So really making sure that the policies change and that they're enforced. The other thing that came up was that they really just saw this as part of a rigged system where police, where we've seen this a lot with, for example, arrests around driving related arrests in the South, and people are then put in prison and they pay fees to get out and right. So we're seeing the same narrative here. And so they were just saying, we're being exploited for financial gain. And officials often talk about these fines as this great solution, but don't take into account that, they don't take into account the consequences of these fines. So a young person said, look, if I got to pay a fine, if I'm low income, how the hell am I going to pay it? It's more about, oh, great, we're not going to write you a ticket. We're not going to jail you, but we're going to give you this fine so we can make more money off of you. So I understand they want to try to decriminalize it, but they're just trying to make money off of people. And it's important to note that $100 fine is not a significant amount of money, especially for a young person. So what we're really doing is we're still looping them into another type of system, but still a system that really does affect the way that they can move forward with their lives. And then the last thing that came up with this was participants really talked about the economic benefits of legalization, particularly as tax revenue was allocated for specific public services. So a community stakeholder in Illinois said, we'll have a new governor and he's promised to legalize cannabis. And our organization recognized that it could be a funding stream to support youth service agencies. I don't know enough about the effects of marijuana, but thinking about in terms of funding, it could have some positive impacts on budgets. So they really hope that that would be one way to increase services. All right, so just briefly with strengths and limitations. Obviously, it's important to focus on youth and young adults. They don't tend to be included as much in the policy narratives and discussion, which is important. We really focused on the ground impacts, which are harder to capture quantitatively, and we thought was important. And we really tried to shift away from these kind of dominant frameworks of morality and really think about, what is going on in young people's lives. Limitations, we focused on New York for the young people, though the stakeholders were across multiple states, but we really wanted to go in depth with people's specific experience, but obviously it's probably very different if you're a young person in Kansas. Many of the youth we talked to were also LGBTQ+, so there may be some intersectionality pieces there that we're working on. And then the participants, like I mentioned, were 18 and older. We do want to start talking to younger kids, high school purposes. To be totally honest, for this one, it was an IRB question. If they were like, we can approve this basically tomorrow, or we were like, you know what, fine. But in the future, we do really want to work with people. All right, so in conclusion, most of the research on cannabis policies among young adults has focused on cannabis use, right? Makes sense, policy, outcome. But this really doesn't take into account the myriad ways that these policies can play out in young people's lives, as well as specifically on the ground implementation. And so youth really talked about how they would use cannabis as a way to cope with stress and why it was so important to legalize for that reason. They also described cannabis decriminal legalization as a way to shift these narratives of inclusion and really try to address some of these really intense, completely understandable lack of trust that they had with law enforcement and how that might play out with their experience with other social services. And this came up a lot with key stakeholders as well. And then also just how cannabis policies really were weaponized in ways that directly affected the health and well-being more broadly of Black and Latinx youth and young adults. So we really need to think about how these policies play out and the way that they convey notions of surveillance. And then lastly, just as a brief background, so cannabis decrim laws were actually passed in the 60s and 70s initially to keep white youth from being arrested. So like the irony is not lost on any of us who do this research, and really thinking about now how they've been reframed as this tool of surveillance. And so really thinking about shifting these policies so we do not exacerbate or hopefully actually can ameliorate some of these environments of fear that we've created, particularly as now for those of you who follow Eric Adams, who's the new mayor, who's like talked about reinstating plainclothes police officers, we're getting dangerously close to stop and frisk, like we're not necessarily going in the right direction. And then also really framing again, how cannabis policies can be a tool to fight negative effects of systemic racism in addition to simply allowing access. And that also means that we have to think about these underlying racism and social inequalities that led to the initial criminalization. And so this means it's not just enough to pass the policies, but actually to make sure that we don't, for example, see these disparities in arrests. And this also plays out too in who gets access to the business aspect that we are building up, right? And so like the legalization really offers this window into sort of political incentives and financial gain more than anything else, as much as we've tried to push for a social justice lens. And so we really need to think about things like making sure arrest, we have expungement of arrest records, and that people actually have access to economics, whether it's, running the dispensaries or whatnot. So really making sure, again, that these policies are passed with a broader perspective so we can actually affect change on the ground. So we're going to end moving forward, really trying to reframe some of these narratives and thinking about moving beyond risk and morality. Also thinking about how the taxes can be used to fund social services and support young people, making sure we focus on economic justice and expungement programs. And then expanding legalization is a way, and thinking of it as a way, and actually talking about systemic racism, right? And white supremacy, and how does that play out in these policies, even if they were not ostensibly created to focus on a specific population. Like anything, it takes way more than a single person to work on this. So I want to acknowledge the colleagues, particularly when you're doing mixed methods work. And thanks to all of you for showing up in person and being online. It's been really fun.
So questions?
I have a question from Rosalie online. I think this came up earlier in your presentation. But do your analyses focus on when the laws were effective or when stores actually opened? In other words, what are you defining as your policy?
Yeah, that's a really good question. And we've actually done it a number of different ways. So we have the medical cannabis law we just had to do, however, the National Survey on Drug Use and Health had coded the laws. For the paper on race ethnicity, we use, I'm gonna blank on her name, whose definition it was, but it is once stores have started to open, was the way that we did that, to try to actually proxy out as close as possible to we could to availability. But that is something that we've had a lot of discussions about, of how best to approximate what is actually happening. So we are trying from now on, or say starting in the last round of analyses that we did in the RDC, is to use the measure of when stores were opening. But we don't know specifically by county necessarily, unfortunately, but that's the next step.
Any questions in the room? I have another one online. Steve Sussman's asking, what types of solutions do you think might stand a chance of being effective?
Yeah, it's funny. I was actually just talking with a colleague this morning of how unprepared I felt in my training to do the policy advocacy work, because I don't know, how do I say this? We tend to lead with data and science, policymakers don't, right? And so thinking about how do we take what we have found, because to be honest, most people don't care, right? They don't actually care that these differential effects are happening. And I say that flippantly, and but I really don't think that's going to have a huge effect on a lot of policymakers in many states. And so I've been trying to think about what is it that we can hook onto. And this is a separate example, but in my work on immigration policy, we just come at it morally from like, yes, we need to pass better immigration policy. This affects mental health, this affects birth outcomes. But what actually ended up happening when we were pushing around driver's licenses, so access to driver's license for people who are undocumented, that under the strange bedfellows category, the cops and sheriffs didn't want people driving without car insurance. Great, when you can get car insurance when you have a license. And so that was actually how we got that through. It is not why any of us from a research perspective would have pushed for it, but it is what allowed it to happen. And I think, as Ricky knows, when in San Diego, when they were doing some of the sort of service programs as a way to expand that, it was actually, again, working with cops who were afraid of needle sticks. And I was like, great, if we get more clean needles out, right? And so I think it's trying to think about what that angle is. I don't know. I love people's thoughts for this kind of work of how to push it. Some of it may just be the economics of it, which is really frustrating. I've tried to think about, if you think about sort of what is becoming the cannabis industrial complex, like what is it from the business perspective that would cause them? The legal is, like I said, legalizing is important. It is not enough, but that is a first step. So but I don't know. There are a lot of things I've been thinking about, but I don't have an answer around how best to do that.
That was a great talk. And yeah, I appreciate your style too. Yeah.
I forgot it's being recorded. I'm like, oh well.
We can edit out that stuff, I guess. That was really cool. So you're talking about in your qualitative research, some of the young people were like, it was the stress reliever to know that they weren't going to get arrested, although they can still get arrested, right? But it's and then I was thinking about your like the first half of your talk about the legalization association with cannabis use outcome. What about like depression or other types of outcomes? And in terms of you're talking about like how does this lead to policy against shut up Siri You can't answer this one. But, you know, it's taken us a long time. Finally, like equity is now, I think, in some policymakers and politicians front lens. And so a lot of it's timing and having the data locked and loaded. And, you know, providing good sound bites, double, triple the da. But anyway, I was just wondering if you were thinking about, those types of mental health related outcomes. If this isn't impacting people's cannabis use one way or the other, negatively or positively.
Yeah, I'm glad you brought that up because it's such a line that I've thought about in substance use work, also particularly my work on, you know, sexual and reproductive health, given where we are with Roe v. Wade, of like this balance of you don't want to pathologize anything, and also you need people to care. But I think if we can show there are associations between, you know, to your point, a lack of passage basically of legalization and mental health outcomes, and it would be really interesting. I've looked at that. I mean, we actually have another paper from the call work that we're working on around that. But quantitatively, I need to go back. I've done it with some of the immigration policies. Interestingly enough, we saw it across race ethnicities in general. So even people in states with more draconian immigration policies who are white have worse mental health outcomes. But that's interesting to think about that, because I think you're right, like that is the way to do it. When you were saying all I could think of is I'm like, oh my God, if they think, you know, basic things are critical race theory, what are they going to think about when we start talking about something like this? But I think it's much more like, but that's about the packaging, right? And that's the piece that I would love to learn more about, but I just don't have the training around that translation piece to policymakers. And that's something that just personally I'm really interested in, because I think so much of what we do, we always have this ideal of course the work's going to affect change. And then we realize, well, yeah, there becomes this churn of like grants and papers. And then it's like, how do we actually find a way? And policy takes so much time. Like I had a specific aim in one of my last grants of like, how do we use data and how do we use evidence to affect change? I remember starting to do interviews about it and everyone was like, oh, that doesn't matter at all. It's just who you know, or if somebody cares. And I was like, well, that was demoralizing, but true, right? But that's right. And so I appreciate that point of like, how do we create, you know, these soundbites and who do we get them to in order to help push that change? Yeah, and sometimes that's not enough. I mean, I'm sure Ricky can, you know, Tesla's like really pissed at Newsom right now, right? And none of us are surprised about the, you know, safer consumption sites, but we have some politicians, right? They had to write the bill. They put that bill forward. It was there. We know Newsom has nothing actually against it, but politically he made that calculus. And so that's what we're up against, right? Like that's not about data. We don't need more data. We have like 40 years of data. And I don't know the answer to that discount. Yeah.
What are some of the?
I'll ask my question after you. That's okay. Go ahead. No, it's okay. Go ahead.
I'm just wondering, what are some of the barriers to getting more qualitative and also quantitative data on who's?
Yeah, that's a great question. I think a lot of it with the quant data is, there are two things. If we want to be able to do the state policy research, we have to have state weighted data. And that is nothing I can collect on my own. That has to come from the national government. So we have the National Survey on Drug Use and Health. It's basically, I would say, working within what we have to try to get additional questions added. So with the Youth Risk Behavior Surveillance Survey, which is high school students out of the CDC, they finally in 2015 added sexual identity to the national level data set. They've now started to add gender identity. So I think it's really working within those broader data sets that we already have versus trying to do it on your own. I think qualitatively, it's honestly, it's not valued in the same way, unfortunately. I think from a funding perspective, that's starting to change. Mixed methods is now becoming more recognized, which is wonderful. But even if you see the types of journals that tend to publish qual, how long it takes to do qual, I think honestly, it's a structural challenge. It's also really hard to do well. And most people don't understand that. They're like, oh, it's fine. Like, I'll learn how to do it. And I'm like, no, I'm never going to be like, you know, I'm just going to learn multi-level modeling this weekend and then do it. But like, somehow people think it's cool that you can do that with qual. And it's like, even taking a class is a great start, but it is really hard to do well. And not just the analyses, but like, there's a lot emotionally to do these interviews, right? And that's a whole thing we can talk about, the ethics of that. But I think a lot of it honestly is structural.
Great talk. I have a question for you based on one of your last slides where you were talking a little bit about the entrepreneurial like opportunities. you know, of cannabis legalization or recreational cannabis legalization. And, you know, California has done something kind of in this vein, has sort of prioritized giving cannabis business licenses to low income and minority business owners, which I think has had the effect of really moving all of the dispensaries to low income and minority neighborhoods. Whereas the primarily white upper income neighborhoods in the LA area, there's no cannabis dispensaries anywhere there. And so I feel like it's a really controversial and kind of conflicting policy and practice that seems to be kind of common. And just was wondering if you had any thoughts on this, particularly as it relates to your comments about closing these disparities rather than widening them.
No, I'm glad you brought that up because I think it is a challenge, and there is that balance too of who has access to the capital to start it up, right? Like, you know, I don't, you know, how long was it between legalization and Snoop coming in, and like, which is great, right? But like, we're getting, you know, now it's oh my God, what's the company? I don't remember, the parent company of Corona is now partnering to make like cannabis infused or alcohol infused cannabis. Yeah, exactly, right. And you're just sort of like, okay, so you have these, you know, companies moving in. I think to your point, it's a really important balance. And I don't have an easy answer. I think there are a lot of additional challenges because it's not legal on the federal level. So the way the monies can't move through banks in a traditional way, you can't get insurance in a specific way. So they're actually in Oakland, they were having a problem where some of the dispensaries that had opened up, where they kept getting people that were breaking in. And then when you don't have insurance, because you can't, like, how do you keep the business going? So I think there are a lot of challenges. And I think it's sort of that the question of, do you want to take the number of dispensaries that are in, say, communities that are already marginalized and have that same amount in other neighborhoods? Or do you want to have it more spread? It's like, what is the end goal? And maybe it would be economic incentives of where the business goes. I think for me, I'm talking out loud of sort of what is the fight to pick at this moment, right? And I think that is an important challenge to think about. And specifically as we have more research around the relationship between density of dispensaries and use. And if we really do start to see that shift, then yes. Especially given, like we saw with young people, the high rates of cannabis use. Just yeah, but thanks for bringing that up. I have to think more about.
You don't have the perfect solution, like.
No, I mean, I have no fear of being like, I don't know.
Thank you so much, Dr. Philbin.